Okay, so we have something a little bit different to wrap up this session. So we welcome Katie Greed, who is a regional representative for the Phelan McDermid Syndrome Foundation in the UK, in addition to being the charity's scientific lead. And importantly today, she's going to be talking about her role as a patient representative and the ways in which we can all engage as scientists with the charity. So thank you very much for joining us today with your talk, Living with Phelan McDermid Syndrome.
Well, thank you for having me.
I'm here today as part neuroscientist, part representative of the PMS Foundation, but mainly as mum to Bella. She has this rare genetic disorder, Phelan-McDermid syndrome, and hopefully by sharing our lived experience, we can increase awareness of PMS and benefit our community. So, what is Phelan-McDermid syndrome? It's a rare genetic neurodevelopmental disorder. There are approximately 4,000 cases worldwide and 360 of those in the UK. It's characterized by absent or delayed speech, global developmental delay, and intellectual disability. The majority of individuals have hypotonia, poor muscle tone, and a reduced perception of pain. Many individuals are on the autism spectrum and have challenging behavioral issues. In infants, there may be feeding issues, gastrointestinal problems, and sleep disturbance is common. There is a severe impact on the quality of life on those with the disease, as well as parents and siblings. Most rely on parents and caregivers for all their daily needs, and many require 24-hour care, and this can be a huge burden on a family. As our PMS population ages and they reach adolescence and into adulthood, patients may experience episodes of psychiatric illnesses such as depression, anxiety, and even catatonia. Individuals may also experience regression and loss of skills. So, PMS is diagnosed by genetic testing, typically a microarray. The manifestations are caused by a deletion of the SHANK3 gene on the terminal end of the long arm of the chromosome 22. The size of deletions range from 0.22 to 9.22 megabases, and this may be a factor into the wide range of phenotypes seen. The SHANK3 gene itself is expressed in the brain and encodes for a scaffolding protein in the postsynaptic densities of excitatory glutamatergic synapses. Haploinsufficiency of this gene affects synaptogenesis and neuronal connections. So I'm going for the cute factor here. Bella herself has a relatively small deletion of 0.5 megabases, but SHANK3 is missing. Physically, she's doing pretty well. She met all her developmental milestones. She's now 13. She can run and swim. We try lots of kids' classes at the gym to try and get her fit and build some muscle, particularly a stronger core. She's not really able to join typical after-school clubs and dance classes because she's less coordinated than her peers and she can't really keep up with instructions. She's got very long limbs and they're quite floppy, more so when she's tired, and her hips, knees and feet all turn in slightly. These days she talks non-stop, but she has speech and language issues and she may not be fully understood by strangers. The main negative for us has been school. Before, when she was at nursery, they were asking for us to get a care plan and a one-to-one assistant, but it didn't happen in time, so she went off to mainstream and she just wasn't able to keep up. This really hit her self-esteem and it impacted how she feels about learning. She'd come home and say things like she's not clever or she's not good at learning like the other kids are. And this period is where she really cemented her skills for task avoidance. she becomes heightened, she makes loud noises, a little bit of swearing, and eventually she kicks and lashes out. And she knows this gets her sent out of class and the hard work stops. So she was removed from school against our wishes. I make jokes about it now, but I'm pretty sure that I've got PTSD from that era. So there was a time when she had no school place at all. And it feels like no place in society. We paid a lot of money to see an education psychologist privately to find another place that would suit her. Most schools that we applied to said no, and only one special school said yes, but it's an hour away by taxi. So this is still not my favourite place for her. Many of her fellow students are non-verbal, so don't feel she gets the socialising that she would with peers. But she's happy to go, and we top up learning with a tutor at home. It's still a mystery to me how she actually learns. Some things go in straight away, and other things take hundreds of times repeating before it goes in. Her school call it a spiky profile. She can read from flashcards, and she's got a great vocab, but she can't really write anything. She has a great depth of knowledge in subjects that she's interested in, like medicine and biology, but other things just haven't connected at all. She can't count, and she's not really interested in maths. She might have inherited that from me. I don't know. The other main issue is her challenging behaviour. When things get too much, she can lash out. And this isolates her from most social situations. It means she's got no friends, and she's become very aware of this. It's become upsetting for her to see her sister being invited to parties and go to sleepovers, and she's not included. She's very friendly and sociable with adults, but she knows it's not the same as having proper friends. We're trying always to learn what these triggers are, but they can be so unpredictable. And I feel this is her biggest block to being part of society. It means somebody has to be with her one-to-one all the time, and the social isolation extends to the whole family. Sometimes we feel like we don't want to join large gatherings, things like festivals, and I'm pretty sure we don't always get the invite. Then there's sleep, and I've put 4 exclamation marks at this point. It's a huge issue for me personally. She goes to sleep pretty well, but she wakes frequently in the night. Apparently I'm the only one who can hear this. And so I didn't get 2 hours sleep together for about a decade, her first decade. And in my notes I've just got mum equals zombie, and I think that's still true. So my work suffered. I wasn't really able to concentrate, and I decided I was needed more at home. This has been really nice. I've been spending time with the girls. It's much more relaxed. I don't have to rush off to catch a train. But it does affect the family finances and my career that I'd worked hard for. But there are positives. Without the sort of typical, logical, developmental trajectory, I feel she's freer to express herself in unusual and creative ways. I've changed the way I parent. I take the accelerator off a bit. I'm still a pushy mum, but I disguise it a little bit. I like to broaden her horizons, so instead of pushing times tables and boring grammar, I follow her interests. She loves fashion and design, so we go to lots of exhibitions and galleries, and she took me into Paris for her 13th birthday. The school situation forced me to give up work, but it's led me back into research that I always loved, and this time it's for her. So this is the current research that's going on at the minute. It's mainly at this Seaver Centre in New York, which is run by Alex Collison. He has pioneered a lot of the research into PMS. They're currently looking at growth hormone and intranasal oxytocin. In Paris, they're looking at lithium capsules and how they assist in the inhibitory process, improving connectivity. Company Neuron Pharmaceuticals in the US has an oral solution that regulates IGF-1. And in Italy, a trial which Bella is involved in, they're using coenzyme Q10, vitamin E and Bs to create a sort of metabolic support therapy to treat the increased oxidative stress seen in several neurodevelopmental disorders. In the Netherlands, they've been studying intranasal insulin. We're currently working on a grant proposal to get some funding to expand this at King's College in London, so I'll go back to my old uni. But the most interesting treatment in the pipeline is coming from a company, Jaguar Gene Therapy in the US. It looks like interesting preclinical results, and now JAG201 has received FDA approval to conduct trials on adults with PMS. The aim is to deliver appropriate SHANK3 function via an AAV9 vector from the Broad Institute via ICV. It's the only treatment so far looking at the root cause of the disease. So this is how to engage with us. I've listed our websites and emails for the foundations here in the UK and the US. The science director in the US is called Kate Stills, and she oversees all our grant applications for new research. The US site also houses our data hub, which is our registry of all our patients with our genetic profiles uploaded, and you can apply for this information and use it in your research. We also have a long-term natural history study that can be used to identify research priorities. We've got Cure Shank organisation, which is run by PMS patients, and they fund targeted research. Coming top of their unmet clinical need is communication, cognitive functioning, social behaviours, and preventing or slowing regression. And so to finish, the PMS community have lots of hope. Hope that these current trials go well and are safe, show efficacy, and also hurry up a little bit. Also hope that this talk encourages further research for people living with this life-altering condition who urgently need more treatment options. The current research, as you saw, is predominantly in the US and in Europe, and we'd love to see some more in the UK, especially with all our amazing universities and scientific talent here today. So feel free to come and chat afterwards, and I thank you for your time and hearing our story.
Thank you very much, Katie. That was a really wonderful overview and snapshot into your personal lives. So thank you for sharing that with us. And actually, it reminds us all why we work in this field, which I think is really important. Any questions for Katie? I absolutely commend you for coming up here as a parent in front of a load of scientists and giving your story. So we've got time for one quick question, if somebody has one. Maybe down here at the front with Rafa?
It's more a comment than a question, Katie. Thank you very much for coming over and telling us about this. I work on rare diseases. I do a lot of outreach. There is this figure of collectively rare diseases affect 1 in 17 people at some point in their life. But most clinicians won't see people affected by most rare diseases in their whole career. I'm from Madrid. I go to see the family regularly. And when I go, I tend to go to a gym. Entirely by chance, I met someone I went to primary school with a few months ago. And striking a conversation, his nephew is affected by Phelan McDermid the chances of that happening
Yeah.
are absolutely remote, but it just highlights that this is there. It happens. It affects people that are all around us. And the outreach that you are doing is really important, and thank you very much.
Thanks.
Wonderful. So if anyone wants to chat with Katie on a one-on-one basis, she actually has a stall in the second poster section, so come along, chat to her. I think we've got some prizes and stuff to give out as well, so do come along in the poster session this evening. So that concludes this session. Thank you all very much for coming. It's coffee break now. We're back at 4 p.m. for the cancer session. Just join me in thanking all the wonderful speakers again.